All right, so today we're going to talk about amiodarone. Amiodarone is a drug that is used for your heart to help it have the right rhythm. It's an anti-arrhythmia drug. So the most common use for this medication is for atrial fibrillation. A problem with this drug is it does require what is called a loading dose. And for that reason, it frequently comes with some transcriptional errors in transitions of care. So for instance, just to give you some context, a loading dose is when you need an effect from a drug to occur sooner than it would take if you were to just routinely dose it at a normal dose. So instead you dose it very high for a short period of time to get the right serum levels, and then you reduce the dose to a maintenance or routine dose. Now, the problem is we will start people on the loading dose and then send them to a nursing home while still on the loading dose. And then it's overlooked to include tapering directions when they are transitioned to that nursing home or even home. They just get directions that say 200 milligrams twice daily. Now, typically it'll be 400 milligrams twice daily for a few days, then 200 milligrams twice daily for a few more days, and then after 2 to 4 weeks, you narrow it down for atrial fibrillation down to 200 milligrams once daily. And with amiodarone, it's got a biphasic half-life, so it's you're going to get a lot of absorption with those higher doses up front. You're going to saturate the fat cells, and then once those fat cells are saturated, then the medication will start to circulate more in the serum levels. And then the half-life will move into another phase where it goes from a 68-day half-life down to about a 30-day half-life. So the problem is we transition people from a hospital while they're on this loading dose, and then they send them to a nursing home or we send them home, and we don't give them directions to taper. And so just remember that if you were started on amiodarone, you will want to follow up with your cardiologist. When am I supposed to reduce this down to once daily? Nursing homes, make sure you educate your residents when they come in on this medication twice daily. And if it says 200 milligrams twice daily was their home regimen, still don't believe it, because what happens is the hospital will call the pharmacy, their home pharmacy, to reconcile what their home regimen was. Their home regimen will include the loading dose, 200 milligrams twice daily, and then they forget to say the rest of it. When they call the pharmacy, tells them 200 milligrams twice daily for 14 days, and then reduce to once daily. A lot of times they actually redo the loading dose, or they overlook the fact that it has a taper in that process. So always educate your residents, ask them if they were taking it twice daily at home. And people who started on amiodarone, or if you were on amiodarone at home and then went back to the hospital, make sure they don't transition you accidentally back to twice daily dosing. Now, if you're taking it twice daily, that is appropriate for people with a ventricular arrhythmia, but not so much for atrial arrhythmias. And the most common, 99% of the time somebody's on amiodarone, it is for atrial fibrillation. So these are very important aspects to understand that commonly create problems in a transition of care. And I have seen this specific error result in hospitalizations if we're not careful. So it's not very common, but the vast majority of medication errors are preventable because we don't do enough to make sure the meds are appropriate and safe and dosed correctly.